Good afternoon, everyone. My study is on the smart vision glasses for the visually disabled, the patient's perspective. There's no financial disclosure or conflict of interest involved in this study. Coming to the introduction, blindness being a very functional burden is an umbrella term which is used to define people with visual impairment worse than 3 by 60 according to WHO. Globally, there are at least 2.2 billion people who have vision impairment, and of these, at least 1 billion people have visual impairment that could have been prevented or is yet to be addressed. The quality of life in a person with blindness further reduces when the vision is hand movements close to face to that of no perception of light. Although many assistive devices have been tried for these patients with total visual impairment of 100%, there's always been scope of improving the assistance that could be provided to these patients. These devices, these digital assistive devices available for patients with total visual impairment are few, and many are not affordable to the patients. Now, coming to the materials and methods which were used in the study, we did a cross-sectional study which was conducted over a period of 6 months from February 2023 to August 2023. 40 patients who were fulfilling the inclusion criteria were included in the study, and their feedback was taken according to the Likert scoring system on the 4 parameters which I'm going to mention. So now the Likert scoring system, 1 stood for very dissatisfied to that of 5, which was the patients were very satisfied. Now coming to the smart vision glasses, so basically this is an assistive device which is attached to the side of like regular looking glasses, and it captures images and then gives the vocal commands on what is there in front of the patient and helps them in reading, walking, and seeing the things around him, and for facial recognition. Now the methodology, so this device needs to be connected to the smartphones with a type C or B type of cable, and requires a smart vision app to be downloaded in the phone. And the inclusion criteria which was used for this study were patients who were willing to give consent, and patients with visual impairment with vision ranging from hand movements close to face to that of no perception of light. The exclusion criteria were patients who were not willing to give consent, patients with hearing impairment, patients with intellectual disability, patients who were not affordable for smartphones, and who do not have access to internet services. Now this is just a small clip on how the device functions. So you give instructions to the patients and it captures the images, and then it tells it out loud. The audio is not playing. Yeah, so this is the reading assistance which is provided by the glasses. Then this is for identifying objects in front of them. So it captures the image and then it tells that there's a black cup which is in front of the patient. It can recognize up to 100 faces and store it in the system. And it also helps in walking assistance and helps the patients in identifying any obstacle which is there in front of them. The observation and results. So we did the study on 40 patients, and majority of the patients belong to the age group of 11 years to that of 40 years, with 13 patients belonging to 21 to 30 years. Now these are the diagnoses of patients who were given a trial with smart vision glasses. Majority of the patients were with bilateral optic atrophy of 22%. 21% of the patients had bilateral phthisis bulbi. 11% with macular scar. 8% with locomatous corneal opacities. 11% with advanced glaucoma, and 19% with advanced retinitis pigmentosa. Out of the 40 patients which were studied in our study, 86.25% of the patients found the device to be helpful, whereas the 90% of the patients found the feature of recognizing the things around them to be helpful. 80% found the walking assistance to be helpful, whereas 90% found the reading assistance, and 85% found the facial recognition feature to be helpful. The overall feedback was that 86.25% of the patients were satisfied with the device, and some of the possible causes which showed unsatisfaction in our patients was that difficulty in learning to operate the device. One was like focusing the camera at the right angle to get legible images. For example, while walking, it's difficult for patients with total visual impairment since childhood to focus at the right angle because they did not look down while walking, and patients were not motivated enough to use the device as they are already used to their walking canes. Now, patients with low vision are often dependent on aids to maximize their ability to orient themselves and perform activities of daily living. And our results indicate that smart vision glasses is a promising device to aid these patients with total visual impairment, although it has a learning curve. And in this study, some of the things that our patients were very comfortable with was the facial recognition feature, recognizing things such as money, I think, which would be very helpful for them, identifying obstacles while walking, and reading also had a very high positive feedback. And in a comparative study which was done in 2019 by Michael Weisbord, it was suggestive that 88.9% of the patients were satisfied with the device, which is compared comparable to our result. Now coming to the conclusion, these smart vision glasses, it's a very promising device which could help the patients in their day-to-day activities, as 86% of the patients found the device to be helpful, and patients with 100% visual disability should be motivated to try these devices as they could help them with their day-to-day activities. And this is a preliminary study which was conducted which showed positive results, and more studies are yet to be conducted to assess the quality of patients who are using these devices in a long-term basis. These are my references. Thank you.
Any questions for the judges, please? What is the distance up to which you can reliably tell the patient while walking?
So it has a good, like the range, I think around 3 meters it can recognize clearly. Further than that, yeah, so because of that they have issues in using it on roads. Also the fast moving traffic is not captured by the device so legibly.